Today we're diving into a critical and life-saving topic, the early warning signs of HIV. The human immunodeficiency virus, or HIV, is a serious condition that, while incurable, can be managed effectively with early detection and treatment. Medical advancements have made it possible for individuals with HIV to live long, healthy lives. Recognizing the early signs and symptoms of HIV is crucial for timely intervention. Early detection allows for prompt treatment, which can significantly improve quality of life. In this video, we'll guide you through the early warning signs of HIV and what steps to take if you think you might have been exposed. Raising awareness about these signs is essential for your health and helps break down the stigma surrounding HIV. We encourage everyone to get screened and seek treatment without fear. If you find this video helpful, share it with your friends and family. Spread the knowledge, and remember, hit that subscribe button and ring the bell so you never miss out on our latest health and well-being videos. Your support means the world to us, and together we can make a real difference. Thank you for being part of our community. Now let's dive in. Imagine waking up one morning, your throat feeling like it's been sandpapered raw. Swallowing becomes an agonizing chore, and even the slightest touch sends a jolt of pain radiating to your ears. This isn't your average sore throat. It could be one of the first warning signs that HIV has infiltrated your body. Unlike the typical sore throat that clears up with a bit of rest and some over-the-counter remedies, an HIV-related sore throat is a relentless, stubborn foe. The reason is HIV weakens your immune system, making your body more vulnerable to secondary infections and slowing down the natural healing process. So, while your friends and family might shake off their sore throats in a matter of days, yours persists, refusing to back down. The intensity of this HIV-induced sore throat can run the gamut, from a mild irritation to a debilitating, agonizing pain that makes even the act of swallowing a Herculean feat. You might feel a burning sensation as if your throat is on fire, especially when trying to eat or drink. And the discomfort doesn't stop there. The inflammation can even radiate to your ears, adding insult to injury. But the throat troubles don't end with just pain and irritation. The weakened immune system leaves the door wide open for opportunistic infections, such as fungal conditions like oral thrush. These unwelcome guests can take up residence, causing visible white patches or redness on your tonsils and the back of your throat, further exacerbating the discomfort. If you find yourself dealing with a sore throat that just won't quit, especially if it's accompanied by other concerning symptoms, don't ignore it. Consult a healthcare professional as soon as possible. Early HIV screening is crucial as it allows for prompt and effective management, reducing the risk of serious complications and improving your overall quality of life. Remember, your health is worth fighting for. Don't let this persistent sore throat be the silent sentinel of a larger battle brewing within. Take action, get checked out, and take the first step towards reclaiming your well-being. Your future self will thank you. Second sign of HIV is muscle and joint pain, a common and often early warning sign of the infection. These pains, similar to the aches experienced during the flu, can be widespread, affecting multiple areas of the body and making daily activities challenging while significantly reducing the quality of life. The cause of these pains is multifactorial, involving both the direct effects of the virus on the body and the immune responses it triggers. When HIV enters the body, it attacks and destroys immune system cells, particularly CD4 cells. This assault triggers a systemic inflammatory response, leading to muscle pain, myalgia, and joint pain, arthralgia. The inflammation is the body's attempt to fight the virus, but it also damages tissues and causes discomfort. Beyond the direct inflammation caused by the virus, people living with HIV are more prone to developing opportunistic infections and other chronic inflammatory diseases. These conditions contribute significantly to muscle and joint pain. For example, HIV infection increases the risk of bacterial and fungal infections that affect the joints and muscles. Additionally, some autoimmune diseases where the immune system attacks the body's own tissues are more common in people living with HIV, further aggravating the pain. Managing muscle and joint pain in people living with HIV requires a comprehensive approach. Treatments may include nonsteroidal anti-inflammatory drugs, NSAIDs, to reduce pain and inflammation, as well as analgesics to relieve symptoms. Physical therapies such as physiotherapy and muscle strengthening exercises can also be beneficial for improving mobility and reducing pain. By addressing these symptoms with a holistic approach, individuals can find relief and maintain a better quality of life despite the challenges posed by HIV. The third sign of HIV is persistent diarrhea, a significant warning sign often observed in people living with the virus. Unlike occasional episodes of diarrhea caused by contaminated food or transient viral infections, diarrhea associated with HIV tends to be chronic and recurrent, often lasting several weeks or longer. Persistent diarrhea in people living with HIV has several causes. HIV itself causes intestinal inflammation by directly infecting the cells of the gastrointestinal tract. Additionally, an immune system weakened by the virus makes patients more vulnerable to opportunistic infections that affect the digestive system, such as bacterial, viral, and parasitic infections. Pathogens such as Salmonella, Giardia, and Cryptosporidia are particularly common and can cause severe and persistent diarrhea. The consequences of persistent diarrhea are numerous and serious. Continuous loss of fluids and nutrients can lead to dehydration, malnutrition, and general weakness. Affected individuals experience significant weight loss, extreme fatigue, and a decreased ability to perform daily activities. Severe dehydration can even be life-threatening if not treated promptly. To manage persistent diarrhea, it is essential to consult a healthcare professional who can identify the underlying cause and prescribe appropriate treatment. This may include antibiotics for bacterial infections, antiparasitics for parasitic infections, and antivirals for viral infections. Additionally, symptomatic treatments such as antidiarrheals and oral rehydration solutions can help relieve symptoms. The fourth sign of HIV is the emergence of skin rashes, a vivid and often alarming warning that can appear within the first few weeks after exposure to the virus. Imagine looking in the mirror one day to find an unexpected eruption of red spots or bumps on your skin. These rashes, commonly referred to as HIV rash, can vary widely in appearance and severity. They may be confined to a specific area or spread across the body, and are often joined by other acute infection symptoms like fever, fatigue, and yes, those telltale swollen lymph nodes. These skin rashes are more than just a surface-level irritation. They are a direct result of your body's immune response to the HIV virus. When HIV enters the system, the immune response ramps up, producing proteins known as cytokines, which play a critical role in managing inflammation and immune reactions. The surge in cytokines leads to skin inflammation, resulting in the notable rash. There are several types of skin rashes associated with HIV, each with its unique characteristics. One of the most common is the maculopapular rash, which appears as small, flat, or slightly raised red or purple spots. These spots can break out on your face, torso, arms, and legs and are frequently itchy, adding another layer of discomfort. The situation can be further complicated by opportunistic infections such as seborrheic dermatitis, herpes zoster, and candidiasis, which people living with HIV are more susceptible to due to their compromised immune systems. Managing these skin rashes often requires a multifaceted approach. Antihistamines can help reduce the itchiness, while topical corticosteroids are useful for taming inflammation. If secondary infections are present, antibiotics or antifungals come into play. But it's not just about medication. Good skincare practices are crucial as well. Using gentle soaps, applying fragrance-free moisturizers, avoiding prolonged hot baths, and wearing loose, breathable clothing can significantly alleviate skin irritation. Maintaining good hygiene and proper skincare is essential to prevent further infections and improve overall comfort. Fifth, signs of HIV are often hidden in plain sight, and one critical yet underrated indicator lies in your lymph nodes. They might just hold the keys to an early HIV diagnosis. Picture those tiny bean-shaped defenders tucked away in your neck, armpits, and groin, ceaselessly working to filter out harmful invaders and keep infections at bay. These unsung heroes, known as lymph nodes, are a critical part of your immune system. When HIV stealthily infiltrates the body, it quickly begins its onslaught, targeting immune cells, specifically CD4 T lymphocytes. This viral attack triggers our immune system into high alert, and one of the earliest and most telling signs of this battle is swollen lymph nodes or lymphadenopathy. Remarkably, this swelling can present itself just weeks after exposure, often during the acute phase of the infection. Typically, swollen lymph nodes are palpable. You might notice tender bumps around your neck, armpits, or groin. While these swollen nodes can cause discomfort, sometimes they remain painless and can only be discovered through a medical examination. Essentially, these inflamed nodes are the war zones where immune cells clash with the virus. In response, your immune system rallies, multiplying lymphocytes in a fervent attempt to beat back the HIV, causing the noticeable swelling and inflammation. These swollen nodes don't go away quickly. They can stick around for several months, reflecting your body's ongoing struggle against the virus. If not managed with antiretroviral therapy, this swelling can become chronic, indicating relentless immune system activation. Over time, this perpetual inflammation can damage the lymph nodes themselves, further undermining your body's defense mechanisms. However, swollen lymph nodes tell us even more. They also signal the presence of other infections that prey on a weakened immune system. People living with HIV are more susceptible to opportunistic infections like tuberculosis, cytomegalovirus, and various fungal infections, all of which can cause lymphadenopathy as well. In essence, those swollen lymph nodes are much more than just a minor medical note. They're a critical alert from your body, indicating an epic internal battle. Detecting and understanding this sign early on can significantly impact the effectiveness of treatment against HIV and its accompanying infections. Stay vigilant, pay attention to your body, and consult a healthcare provider if you notice any unusual lumps. It could be a crucial step in safeguarding your health. Another early warning sign of HIV is menstrual changes, a symptom that many may overlook, attributing it to normal hormonal fluctuations. These changes can manifest as irregular periods, heavier menstrual flow, or even missed cycles, which can be both alarming and confusing for those affected. Such irregularities occur as the body grapples with the virus and its impact on the immune system, leading to hormonal imbalances that disrupt the menstrual cycle. The underlying mechanisms are complex. HIV targets and affects the body's immune response, which in turn can create stress that influences hormone levels. Furthermore, menstrual changes can signify the body's struggle against the virus, reflecting the broader implications of HIV on overall health. For some women, These symptoms can lead to increased anxiety and concerns about fertility and reproductive health. Recognizing menstrual irregularities as a potential indicator of HIV is vital for encouraging prompt testing and early intervention. Women experiencing such changes should seek medical evaluation, as addressing the root causes can lead to effective management strategies, including lifestyle adjustments and medical treatments, ultimately empowering individuals to take control of their health. Another early warning sign of HIV is influenza-like illness, which many might initially dismiss as a common cold or flu. This symptom can present as fatigue, fever, chills, body aches, and swollen lymph nodes, creating a sense of malaise that disrupts daily life. The flu-like symptoms occur as the body reacts to the HIV infection, particularly during the acute phase when the virus first enters the bloodstream. The immune system fiercely fights back, resulting in an inflammatory response that manifests these uncomfortable symptoms. Thus, it's important for individuals at risk to recognize that persistent or unusual flu-like symptoms warrant further investigation. Moreover, understanding that flu-like symptoms might indicate the body's initial struggle against the virus can help promote timely testing and diagnosis. Another early warning sign of HIV is night sweats, a common symptom that many may initially dismiss as just discomfort during sleep. These episodes can be intense, leaving individuals soaked and often startled awake, disrupting not just nighttime rest but overall well-being. Night sweats can manifest as a response to the body's struggle against the virus, and they may significantly impact the quality of life, leading to anxiety, fatigue, and difficulty concentrating during the day. The underlying cause of night sweats in HIV patients is complex, involving both the virus's direct effects and the immune response it sparks. When HIV infiltrates the body, it targets and destroys critical immune cells known as CD4 cells. This damage prompts an inflammatory response as the body attempts to combat the invader, with fever and sweat production often being part of this reaction. The resulting fluctuations in body temperature can lead to excessive sweating, particularly at night. In addition to being a symptom of HIV itself, night sweats can signal the presence of opportunistic infections that are more likely to occur in immunocompromised individuals. These infections can activate the immune system further, leading to heightened sweating as the body struggles to regain balance. Addressing night sweats effectively involves understanding their root cause, and individuals may benefit from medical evaluations to explore management strategies that include lifestyle changes, such as cooling sleep environments and adjusting bedding, along with potential medications to stabilize the body's response. Another early warning sign of HIV is shortness of breath, a symptom that can manifest unexpectedly during normal activities, adding distress and confusion to daily life. This sudden breathlessness can be alarming and, in the context of HIV, indicates that the body may be under significant stress from the virus's impact on the immune system. As the infection progresses, it can compromise lung function, leading to significant challenges in performing even the most basic physical tasks. The mechanism behind shortness of breath in HIV-infected individuals is multifaceted, originating from both the virus itself and the body's immune response. HIV attacks CD4 cells, causing a cascade of immune reactions that can inflame lung tissue and impair oxygen exchange. Additionally, individuals with HIV are at an increased risk for opportunistic infections such as pneumonia or tuberculosis, which can further complicate respiratory issues and exacerbate feelings of breathlessness. Managing shortness of breath in people living with HIV is crucial for maintaining a good quality of life. Treatment may involve a combination of therapies, including medications to address underlying infections and anti-inflammatory drugs to reduce lung inflammation. Pulmonary rehabilitation programs can also be beneficial, providing tailored exercises to improve lung capacity and overall fitness. By recognizing and addressing this symptom early, individuals can take proactive steps toward better respiratory health and maintain a more active and fulfilling lifestyle despite the challenges posed by HIV. If you found this video interesting and informative, please don't keep it to yourself. Like, subscribe and share. Thank you for watching.